Hi, I'm Dr. Cecilia DiMartino. I'm a naturopathic doctor at Willow Wellness Clinic in Waterloo, Ontario. This is part 4 of my 6 video series on pregnancy and having a baby. And so this video is about testing, what kind of testing to expect or maybe even ask for when you're pregnant, as well as we're going to be talking about options for if you become overdue and if your baby is breech. So testing. So the first thing that you get done is, a blood test to obviously confirm your pregnancy. The human HCG is the hormone that they check in the blood, and when that is elevated, that usually means that you're pregnant. Another thing that should be monitored, maybe even early on in your pregnancy and possibly even later on as a repeat, or areas in your blood, such as looking at your blood sugar levels to make sure, because one of the risk factors with pregnancy is diabetes, so ruling that out. So your doctor will recommend the testings for that. Also looking at thyroid health. So pregnancy is, puts a toll on our thyroid function. Our thyroid is our gland located in our neck that has to do with our metabolism and energy production, that type of thing, and it's just really important for it to be working well, especially in pregnancy. Another thing to look at in the blood is your iron status, your ferritin levels, which is stored iron, looking at what's called the CBC, which is the complete blood cell count, looking at red blood cells and your white blood cells. And just making sure that everything is looking normal, that you're not iron deficient, because the baby is going to actually just take and take and take. And so you almost want to have a little bit extra, if you will. I mean, obviously too much iron is bad, but getting that at least checked and to see where you're at, because you're going to already be tired being pregnant, and then if you add in iron deficiency, it's just not a great combination. So make sure that your midwife, your OB, and your naturopath are checking for that. Ideally, you're getting your blood work reviewed by a naturopath. So the medical doctors are obviously, and even midwives, I mean, they're there to make sure that nothing is absolutely wrong and all that. But what we also want to look at is how optimal these numbers are. And so a naturopath has a lot of knowledge around that, where things can be, tweaked. And then another test to look out for that doesn't get often routinely checked, but I do strongly believe that it should be, is actually your vitamin D levels. So vitamin D, it's a vitamin, but it acts as a hormone. It's very much connected for, your bone health and absorption of calcium, as well as your mood, your immune system. It's just an important vitamin to optimize for yourself and the baby. So checking those levels are really important, and consulting with your naturopath in terms of what dosage of vitamin D you might want to take above and beyond what's in your regular prenatal, especially if your levels are low. So you should consult about that and at least get it checked. Now, vitamin D is not covered by OHIP, so it's about $37 to get that tested, but I really recommend that you get that done. The only exception is if you have osteoporosis or osteopenia, then it should be covered by OHIP. So these are some of the basic blood tests, or there are, I'm sure, other ones too that they look at in terms of your your vaccination sort of status, your blood type, all of these things. They will naturally sort of screen, so you shouldn't have to worry too much about that not getting done. And then in terms of imaging, so X-ray of course is out when you are pregnant. You want to avoid that. So when you go to the dentist, you make sure you just tell everyone that you are pregnant, just so that they are aware and they know what to avoid. But basically what gets done, which is generally regarded as safe, are ultrasounds. So an ultrasound, this is, unless you have complications or any issues, usually you get an ultrasound, what's called a dating ultrasound or an early ultrasound, around the 12-week mark, 9 to 12-week mark, and that allows for them to, give you an estimated due date a little bit more accurately than when you're based on just when your last period was. So usually that's done, and then about around 20 weeks ish is what's called the anatomy ultrasound. That's the long ultrasound. So that's the ultrasound where it's about an hour, and they take a ton of pictures. They check, everything, the baby's hands and feet and their heart and their, kidneys and their abdomen and all the organs and their head and et cetera, and the brain. So this is an important, very important ultrasound to make sure that everything is normal, that everything is developing well, etc. But it just takes a long time. So just be prepared. Luckily, you don't have to have a full bladder, which is great. And a lot of times they will also do an internal ultrasound. So it's an ultrasound that they do transvaginally to see where the placenta is attached, if it's too close to the cervix, which is the opening, or not. So these are all things, of course, all the results will be discussed with you. With the OB or your midwife, but it is a long ultrasound, and if you bring your partner with you, know that your partner, whoever's going to come with you, is going to be waiting for about an hour in the waiting room before they let your partner come in, and then both of you can look at images of the ultrasound. They don't usually show you the images of the ultrasound while they're taking the picture, so you're just kind of getting poked and prodded and lying there and breathing and staring at the ceiling and listening to some music for almost a good hour before they actually let you see. So just so you know, it's nice to be prepared and know what you're expecting. Another test that gets routinely done is something called Group B strep. So strep we know of sort of as sore throat, but there are different kinds of streptococcal bacteria. So Group B strep is usually what they screen for or test for, usually in the third trimester, closer to when you're due. It's usually just a swab that is around the vaginal area as well as the anal area, and they're just looking to see whether you have this particular bacteria. There is research to show that this bacteria, when it's present, and if you're having a vaginal birth, can infect the baby and can cause harm. And so if they do the swab and then they culture it and then they tell you what the results are, if you are group B strep positive, then you will be hooked up to an antibiotic IV during labor. It's sort of the how they deal with it. As a naturopathic doctor, I prepare all my patients in the sense that we look at diet, we look at probiotics and other things that can help reduce the chances of a positive group B strep. But of course, the screening is done. You have obviously always the choice of declining anything, but that is up to you. I would do more research on pros and cons about that and whether you are comfortable with even taking that risk. The good thing about if you get a group B strep negative result, that allows you basically what happens is if your water breaks and you don't get any contractions, nothing is happening, and you are group B strep positive, it's a little bit more dangerous for the baby. And so, that's where then they'll intervene a little bit quicker, like they'll maybe induce you to get the contractions going, to get the baby out, because you don't want to have the baby sit there with its membranes broken and having access to the outside world, if you will. However, if you're group B strep negative, it buys you more time. What that means is you might have 24 hours before they actually will induce you, and so you can try to get your own body to sort of kick in and do what it needs to do. So just a tad of information about that. And then the only other areas that I wanted to quickly talk about is being overdue and having a breech baby. So being overdue, especially with your first, is very, very common. So in hospital, they'll let you go about 10 days over before they intervene. provided, of course, everything is going well and there's no issues with the baby. I believe with a home birth or midwife, they can technically go up to 2 weeks overdue, but, again, they're monitoring the baby and they're checking the baby's health. But what can you do? Let's say you're at your due date and nothing has happened. You can get acupuncture. Acupuncture can, in specific points, can be very stimulating, as well as something called moxa, which is this herbal heat to specific points. That can be really stimulating and help get things moving naturally. Intercourse, sex is good. Castor oil, you want to be careful with that. That is something that you would want to discuss with your midwife, naturopath, or naturopath to determine if that is something that you want to do, because it's a pretty violent laxative and can really get things going sometimes a little bit too violently. So you just want to be careful. Movement, of course, moving around, anything that you can do to kind of, get things going is a good idea. And then if your baby is breech, so this is kind of an issue, because breech means that instead of the baby being face down where it needs to be, it's face up. And it's very rare, especially in this region, to find an OB that it would be even comfortable with vaginally delivering a breech baby, because there are risks inherited. The baby's meant to come out head first. So what can you do if you find out that you are breech? So first of all, again, acupuncture, very good, very safe around that. It can help turn the baby. I would definitely seek out the help of an osteopath and a chiropractor. They have their techniques that can help turn a baby. Visualization, believe it or not, and I know it sounds weird, but visualizing your baby being face down and ideally facing your back. So that's the ideal position of a baby, is the baby's face down and facing your back or your bum. Is kind of where the baby should be. So if you visualize that, that can sometimes help. And then lastly, your OB, maybe even a midwife, if they're trained, to actually sort of manually try to move things. So that's if they're comfortable with that and want to do that, so that you can hopefully avoid basically a C-section with that. So, and lastly, what you can do to help your sort of uterus prepare for pregnancy is red raspberry leaf tea. You can take that in your third trimester. And definitely once you're due, then it's you can take a lot of that, and because you do want to get things moving. So so hopefully that was helpful. Again, this is part 4 of 6. So hopefully the other videos are helpful as well. Thanks.